Thank you for joining us. So Dr. Chusid is our Dean for Preclinical Education at NYCPM. So what she's going to be doing is giving us an overview of the curriculum, years 1, 2, 3, and 4. So Dr. Chusid, do you want to take over?
Yeah, so first of all, thank you everyone for joining us and your interest. I want to stress that how well-trained our podiatric physicians are, that the first 2.5 years of your podiatric medical school curriculum is identical pretty much to allopathic, in that biochemistry is biochemistry and general anatomy is general anatomy. So why don't we start with term 1? We've recently changed and updated our course in bacteriology. It is now medical microbiology. And that is taught by a bacteriologist and a virologist. And that course is very, very important because it's a prerequisite to your second year course, a very intensive course in infectious diseases. And so that the podiatric physician is really, as you enter your 4th year and your first year PGY1 of residency, you are pretty much on par with your allopathic colleagues when it comes to infectious diseases, maybe ahead given the experience. Our virology, the virology portion of both courses is taught by a virologist from New York Medical College. So it's both courses are pretty intense, and students rank them very highly in terms of how satisfied they are and how well prepared they feel that those courses have prepared them to go into their clinical training. In terms of biochemistry, I know that maybe some of you were out there rolling your eyes and saying, oh, not again. However, this is medical biochemistry. And by that I mean, you're going to be reviewing, those of you who have had biochemistry, much of it will be familiar, but the applications will be new. So you will be working on second order thinking, the application of these biochemical processes to the functioning of specific organ systems. You're going to be talking about absorption. You're going to be talking about digestion. Obviously, you're going to be talking about liver enzymes, but where do they all fit in? Where do they gel to the well-being of the whole human organism? And we'll get to abnormalities in just a second. I teach cell biology and histology, which really is microscopic anatomy. In histology, we look at tissues. In general anatomy, for instance, you would look at the lung. In microscopic anatomy, we dissect out the lung, take a tissue specimen, and look at the structure of the tissue and the cells making up that tissue. And it's pretty fascinating because as one looks at the cells making up a tissue, one can rapidly understand, almost at an intuitive level, wow, what if this goes wrong? Or what if that goes wrong? And again, this course is a prerequisite for pathology, which is microscopic anatomy on steroids, if you will, because now you're going to be looking at tissues in second year and making a diagnosis, okay, based on that. And similarly, tying in with biochemistry and cell biology, we're one of the, if not the only medical school that has a separate genetics course. And really, this genetics course is looking at the obviously heritable, inheritable abnormalities one would find, but linking them to the biochemistry and to the cell disorders that one will see later on in pathology, and introducing early in your medical career absolute symptoms, absolute names of diseases, where they come from, what the genetic defect is resulting in the biochemical defect resulting in the tissue and or organ abnormality. So that's a very early introduction to clinical medicine and personalized medicine in your first year, in your first semester. And along with that, we teach physiology. And physiology is a specialty devoted to the function of organs, tissues, and cells. For instance, the eye will show you the cell. The bacteriologist will tell you how an organism gets into the cell and disrupts it. The biochemistry professor will be telling you what has to happen for that cell to function normally and be a good member of a tissue, and the tissue a good member of an organ. I tell you, what that tissue looks like. The physiologist is going to tell you what the normal functioning tissue and cell produces, functions, and what those functions may be on another organ. And if one takes away those functions, what the results are. So this is also a very clinically oriented course where the students will take away case studies and now bring them into their second semester, where you'll look at the whole body, dissect the entire body, just like the allopathic medical students do. And we'll now introduce the nervous system to you. So now you've got an overall view of an entire body, from the gross to the microscopic to the functioning to the cellular. And now we move into your second year. The second year is devoted to abnormalities. You're experts after 1 year in normal functioning. At the end of the second year, you have to be good in determining abnormal function, what it is that is wrong. So instead of neurosciences, you now be doing neurology. You will be learning a neurological exam, what the symptoms are of, for instance, stroke, what the symptoms are of spinal cord injury. And you will be now specializing after general anatomy into minute dissection of the lower anatomy. This is where your specialty starts. And you'll be doing the lower anatomy, you'll be doing pathology, the abnormal tissues, okay? You'll be doing dermatology, abnormal skin, okay? We start introducing you to something that we're finding more and more students are interested in, and that's clinical research. We will be training you. You're going to have a certificate you will be able to conduct your clinical research study and be able to obtain informed consent. Now, the big test, as Dr. Perez said, you will now have to pass part 1 of your boards, which goes into all these subjects. But now the fun begins. You put on your white coat in July of your third year, and now you move into your clinical years. And you take all these clinical subjects, which we've moved this year to a block curriculum, which we think is going to be a marvelous addition to our curriculum, that you'll be taking surgery in an intensive manner with nothing else. Internal medicine, intensive manner, nothing else. Okay. So I think that is going to be a really fabulous addition to fabulous correction, I would say, to our curriculum, and will dovetail beautifully with our what we present with you in the first year. So you're going to be moving in there with pharmacology, pathology, neurology, dermatology, microscopic anatomy, general anatomy, pathophysiology, abnormal physiology, and you're going to be starting as becoming clinical experts. So as you go out into your fourth year and your clinical clerkships, you are going to be right there with allopathic medical students, and you're going to shine. So, and at the end of fourth year, you will take your clinical boards, your podiatric medical boards part 2, and you'll be taking part 3, but this is a little bit different. You'll have to take that if you need a certificate to practice it, which is sort of an interim license. And the way the law reads is you have to have a DPM degree to sit for that. So more than half of our students sit for that exam almost immediately post-graduation. And we usually have 100% pass rate in that exam. We also have very high pass rates in our other board exams, higher than I'm not going to knock our sister schools, but we do better. And in terms of our clinical rotations, our students certainly stand out nationally and in some cases internationally. So
thank you, Dr. Chusett. Actually, just so our audience gets a better understanding of what the rotations in their third and fourth year is like, Dr. Perez, if you don't mind jumping in, it hasn't been that long ago. If you can please, if you can please elaborate on the rotations in the third year, what it encompasses, and also talk some about externships and the other external rotations that our students do their fourth year in internal medicine, general surgery, and such.
Sure. So your third year, the beauty about NYCPM is that you have a clinic right on the first floor, right? So the clinicians are there, you have patients coming through. So your third year, you go straight there, and that's where you do your rotations. And maybe Ronald, since you're going through it right now, I'm assuming you can also jump in. But this is where you get a little bit more of patient care. So everything Dr. Chusett was just speaking about, you're in a classroom, and she was reminding me, you know, of like infectious diseases, you know, all the classes that kind of made me like, but you know, you study, you get through them, you do well, and then you get to put it all into action. And that's with your rotation. So you see the list there, you do, you know, your general pediatric medicine, pediatric surgery, obviously was one of my favorite ones. You have some great surgeons at the school. Radiology, you learn everything about x-rays, MRI, CT scans, when to order, how to take them, because you have an x-ray lab down there. So when the patient comes in, you are the one that's actually taking the x-rays, and you learn how to do all of that. Wound care, personally not my favorite, but it's definitely there. You see, you know, the school is on 125th Street, so you're right there. You're going to see a lot of wounds. You're going to see, unfortunately, you know, because there's no blood going to it, right? So you get all these crazy wounds. There's also some great clinicians in regard when it comes to podopediatrics, and that's where I learned all the bracing and how to deal with the kids and helping them walk. And when you have a child that is limping or because of some deformity, and you can help them, right? It's really rewarding. Sports math was another one of my favorites, but basically your third year, you're into blocks. You do 3 months of certain rotations, and then you go to your next rotation. And I think Ronald can probably speak a little bit better of that, but I could tell you about fourth years, which was my personal favorite, because now you're done. Now you get to go out and experience an externship, which are 1 month long. And I went to San Diego, I went to Denver, I went to Seattle, I went to Boston, and I basically lived there for a month. It can get a little expensive, but you know, this is what you're going to do, right? So you're investing in yourself. This is going to be your profession. This is what you are going to do. So I wanted to go out and learn everything that I could. New York is wonderful, but podiatry does change depending on where in the country you are. So I wanted to go out west just to compare to what was being done in the east side. So they're a month long, and you are just part of the team, right? So residency programs, this is where you get to decide which residency program you want to go to, or you might learn that you don't want to go to that residency program, right? Because you didn't enjoy a certain aspect. Maybe you want to do more wound care, and you picked an externship that doesn't really see wounds, so you're not a good match. And you have to be a good match from both aspects, right? So they have to be like, okay, he or she is a good candidate, and the same thing for you. Okay, this is a place where I could see myself for the next 3 years, because that's where you're going to be, right? So you have to both kind of like each other, and it works out. But for me, fourth year was I learned so much that 4th year, just going everywhere, traveling, and learning from different attendings in different parts of the country. But that's when you take your part 2, and then you are set. Although now you can take part 3. I'm not sure. I don't recall when you take part 3. I'm sorry. I'll let you guys say that because it was a little bit ago.
So part 3 is actually, it can be taken while you're in residency, or it can be taken your 4th year. So actually, I would say about 80% of our graduating class took part 3, and we actually had 100% pass rate this time. So our students do really well on the licensure exams, part 1, part 2, and part 3, but especially part 2 and part 3, we've always been way above the national average, and usually resulting in 100% pass rate. So shall we go to the next slide?